session, we shall have a discussion on the basic structure of long bones, short, flat, and irregular bones, their basic structure. Then we shall have a discussion on bone markings. So basically, let's go ahead. Long bones consist of diaphysis, that's the shaft, and epiphysis, that's the end of long bones. So initially we had some identification of long bones, which includes the femur, humerus, the tibia and fibula, and we also had this bone of the clavicle and others. So long bones have diaphysis, which is composed mainly of compact bone with central medullary canal. And this central medullary canal contains the yellow bone marrow as in adult, but in children, you may find some red bone marrow. Epiphysis is the expanded ends of long bones with outer covering of compact bone with spongy cancellous bone inside. Yeah, so the epiphysis is the expanded ends, and most of it has some marks or landmarks whereby these are regions for muscles and ligaments and also tendons attachment. Proceeding with that, the diaphysis and the epiphysis are separated by epiphyseal cartilage, which ossify when growth is complete. So diaphysis and epiphysis are separated by epiphyseal cartilage, which ossify when growth is complete. We also have some additional information whereby the metaphysis is a flared region of bone in mature bone, where the diaphysis joins the epiphysis. It's a flared region of bone in mature bone. So consider the term in mature bone where the diaphysis joins the epiphysis. Then we have the physis or the epiphyseal plate. And this is found in children and is the area in growing bone where hyaline cartilage is replaced by bone and thus allowing diaphysis to grow in length. So this is the area of growing bone. In children specifically, where the hyaline cartilage is replaced by bone, thus allowing diaphysis to grow in length. That's the shaft. On the basic structure of bone, we have the two bones. The first one on my left have this basic structure, which includes the epiphysis of which we have been talking about, the metaphysis, this flared region of bone around here where the diaphysis meets the epiphysis in adult. Then we have the diaphysis being the shaft. From here to here is the diaphysis. We also have the metaphysis here, and then the epiphysis. And we also have the compact bone surrounding the long bone. And we have also the spongy bone on those other areas of epiphysis. This advanced one, we have also the covering of the bone, the periosteum, the perforating fibers, the nutrients arteries entering through the periosteum. We also have the compact bone here. We have the epiphyseal line around here. We have the spongy bone here, and the spots are the red bone marrow. And we have the articular cartilage covering the ends of long bones, and this is part of joint. Also, articular cartilage is found on the distal part. This structure was taken from femur bone, this bone of the thigh. So that's all about basic structure of long bone. Moving ahead, we have short, irregular, and flat bones. These are bones that are formed from fibrous membranes, of which we learned from our previous discussion. So, thin lining of periosteum covers compact bone on external, with endosteum covering the internal spongy bone. So, these are the lining of short, irregular, and flat bones. So, we have the periosteum covering the outer, and the endosteum covering the internal spongy bone. They have no diaphysis or epiphysis as in long bone, so they have no extremities or the ends. Bone marrow are contained within or between the trabecula, the bone marrow, the red bone marrow, which we had seen in earlier discussion. They are contained within the trabecula of short, irregular, and flat bones. And those bones include the bones of some bones of the skull and the sternum. Have them right away. So this is one of the example of flat bone. This was taken from parietal bone of the cranium, and this is the compact part. This is the spongy part, and it's called diploid, as in for the case of flat bone. And this other side is hard compact bone. So as stated earlier, we move ahead to bone markings. So bone markings are where we find the grooves, basins, and we also have some slits where nerve tendons and ligament can anchor. So first of all, we'll start off from this tuberosity, which is a large rounded projection and may be roughened. A tuberosity is a round or a rounded projection that may be roughened. And for the case, we'll check for this, which is a tuberosity of tibia. Tuberosity of tibia. This is found on the proximal part of tibia. Tibia bone is where we find this tuberosity. So when you palpate or when you try to touch your leg on the proximal part, just underneath your skin, you'll be able to palpate a hard kind of structure, and that's called the tibia tuberosity. Trochanter. We have trochanter, a very large, blunt, irregular shaped process. This is a blunt, irregular shaped process, and definitely these are sites for attachment of muscles and some ligament. And for our case, we were able to identify one of the trochanter, which is this is the lesser trochanter of the femur, and the other one is the greater trochanter of the femur. This image was taken from medial aspect, and the other one was taken from posterior aspect. Moving ahead, we find out we have a crest. A crest is a narrow ridge of bone, usually prominent. A narrow ridge of bone, just a ridge of bone, and usually is a prominence. And for our case, we were able to identify the iliac crest from ilium. This is a pelvic bone, and this is a part of crest. We have a line. A line is a narrow ridge of bone, and it's found for especially the bones of femur. And this is intertrochanteric line. Right here, we have the intertrochanteric line connecting the greater and the lesser trochanter, intertrochanteric line. We also have a tubercle. This is a small rounded projection or process. A small rounded projection or process. And for our case, we were able to identify this tubercle from humerus. We have the greater tubercle just as the trochanter, and the lesser tubercle just as the same as the trochanter. We also have epicondyle. Epicondyle is a raised area on or above a condyle. A raised area, just something, a prominence that is raised just above a condyle, which we will check where the condyle are found. So epicondyle, for our case, we were able to identify the epicondyle for this right humerus, which was taken from anterior aspect and also from the medial aspect. This is the medial epicondyle, and this also is the medial epicondyle of humerus. We have a spine. A spine is a sharp, slender, often pointed projection. Spine is a sharp and slender, and that's a pointed projection. And for our case, we were able to identify the spinous process of scapula. This is the spinous process of scapula, and it's found from posterior aspect of scapula. Also, other bones such as the vertebral bones have their own spine or spinous process. A process, just a process, is any bony prominence. Any bony prominence. And for our case, we were able to identify this prominence from this aspect of radius near the wrist joint, and this is the styloid process of radius. The head. Head is a bony expansion carried on a narrow neck. A bony expansion, something like a bony expansion, that would be definitely called head. For our case, we were able also to identify the head of femur. Sorry, this is not a humerus, this is a femur. Just a little error. This is a femur. This is the head of femur. Also, for the humerus, we also have the head, of course, and that will form that will definitely form part of humerus on humeral bone. But this for our case, this is still femur. Sorry for just some little errors. We have facet. Facet is a smooth, nearly flat articular surface, where there's articulation with another bone. So, and for our case, we were able to identify facet for articulation with rib. This is a facet for articulation with rib. We have a condyle. Remember, we were talking about the epicondyle, a raised area above the condyle. And for this case now, we are going to check about the condyle. Condyle is a rounded articular projection on a bone. And for this essence, or for this case, we'll be able to identify the condyle here, which is the medial condyle of the femur. This is the medial condyle of the femur, which articulates with another bone, which is the tibia, to form a joint. We have a ramus. A ramus is an arm-like bar of bone, And for our case, we were able to identify the ramus of mandible. This is now the ramus of mandible, just an arm-like bar of bone. This is a cranial bone, this is a mandible, this is a maxilla. But this we'll be able to discuss much and more about exclusive bones and the anatomical features of structure. But for this case, let's just check on the ramus of which we were able to check down there. We have the meatus. The meatus is a canal-like passageway. For this case, we have the external acoustic meatus. This is where ear is from the ear, the prominence of ears and other structures. And this is a temporal bone. This is a temporal bone whereby we have this external acoustic meatus. We have a sinus. Sinus is a cavity within a bone filled with air and lined with mucous membrane. So a sinus is a cavity within a bone filled with air and lined with mucous membrane. For our sake, we have the sphenoidal sinus found on sphenoid bone. This is a sphenoid bone, and that is a sphenoidal sinus. Sinus has its own function, and we will be able to discuss in other topics that will come later. We have a fossa. A fossa is a shallow basin-like depression in a bone, often serving as articular surface. For this case, we have olecranon fossa, where the olecranon just finds its way here. So this is now the olecranon fossa, whereby the olecranon finds its way. The olecranon is found on the other bone, which is the ulna. The proximal aspect of ulna, we find the olecranon. Groove is a furrow, just a furrow. And for our case, we have intertuberculous groove between the greater and lesser tubercle. And in some cases, some others considers it as a sulcus. So this is the intertuberculous groove or sulcus just here. We have a fissure. Fissure is a narrow slit-like opening, and for our case, we have here the inferior orbital fissure. This is the case, just a narrow or slit-like opening. We have a foramen, which will mark the end of our today's discussion, and this is a foramen, which is obturator foramen, a round or oval opening through a bone. Yes, some vessel and neurovascular elements pass through that position. There are other muscles that attaches to this foramen. Thank you for your attention. Please remember to subscribe.